So today we are going to go over some in-home support options for seniors. A little overview of what we are going to go over today. I am going to talk a little bit about ElderHelp's Employee Family Caregiver Support Program, which this webinar is through. I'm going to talk a little bit about what it means to age in place, when you might start to notice that seniors need some more help in their home, different types of services to help in the home, and then I'm going to mention some events that are coming up for family caregivers. So here at ElderHelp, our mission is to provide personalized services and information to help seniors remain independent and live with dignity in their own homes. And one of the programs that we do have is our Employee Family Caregiver Support Program, which is what this webinar is through. We can come into any business and do a presentation around family caregiving. We attend corporate health fairs, wellness fairs. We, of course, have this webinar series that happens on every third Thursday of the month. And we also have our online courses that are available on our website that offer some education and assessment tools, information for family caregivers. And it's something that you can access at any time from any place as long as you have the internet and a computer. So I'm going to start with why do seniors want to stay in their own home so much, and how long can someone safely do so? A statistic I always like to start with is, according to AARP, about 90% of seniors do want to stay and age in their own home. It is something that most people, when you ask them, they kind of just assume that they're going to do so. Home is our safe place. It's familiar. It makes people feel they're still independent. A lot of people have fears of going into living facilities because of abuse or neglect. And most importantly, it just feels comfortable. Home is our safe place. If your loved one does want to stay home, it's important that you talk to them about why do they want to stay home? What's so important about home to them? Is it because they want to keep a pet, or they want to continue to have visitors and they're afraid that if they don't stay at home, they won't be able to do those things? Or maybe they want to stay home, but they want to have a new home. They want to downsize. Maybe they want to move to a new city somewhere where the weather is really nice or closer to family, grandkids. Typically, staying at home does cost a little bit less. It costs about 20% less than what a nursing home costs on a monthly basis. And this obviously depends on whether you own your home, you rent, HOA fees, if you have to make any kind of modifications to your home. And the biggest reason is people don't want to lose their independence. A lot of things are being taken away from seniors, their ability to drive, their ability to make decisions. And if you take home out of that mix, it can be really debilitating. So aging in place is a term that is often referred to when talking about aging at home. And it is defined as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. So when does somebody need more help to stay at home? So here are some signs that maybe you might identify in someone that you are caring for. And if you don't already identify them, things that you might want to look for, so that you can have that conversation about maybe it's time to get a little bit of extra help or move. So poor eating habits, this can include dehydration, losing weight, or maybe not even eating healthy foods or stop cooking for themselves. You're finding many expired foods, moldy foods in the fridge. Maybe for someone though, it could be hard to reach something on a top shelf, to use utensils to eat or to cook. Or maybe someone's just simply losing their sense of taste and smell, which can be very common as we age. Someone has a fall, that's a huge indicator that they might need some help at home, and we'll talk a little bit about this later on of how we can make our home safe if we want to stay at home. Forgetfulness, so this doesn't necessarily mean that somebody is developing dementia, but it could be a sign. Forgetting things like appointments, they're misplacing common objects like their keys, their glasses, their phone. getting lost while they're driving or walking around their neighborhood to the doctor's office, somewhere that they go very often. They're not paying their bills, things like that. Their bathroom use and their personal hygiene is starting to decline. So they don't have unwashed, or they have unwashed hair, or their hair isn't looking groomed or combed, their clothes aren't looking clean, they're wearing the same clothes over and over again, maybe because it's easy to put those clothes on, they don't have buttons or zippers, they're not using the toilet on their own, or they're wetting the bed frequently. Their home is starting to look cluttered, dirty, or disorganized. Maybe they're not checking the mail, they're not doing the dishes, they're not doing their laundry, their lawn and garden is looking unkept. They have some unexplained bruises or scratches or bumps, and they don't know how they got there, or they're too embarrassed to tell you how they got there. They're misusing their medications, forgetting to take their medications, taking expired medications, forgetting to pick up their prescriptions, not remembering what a certain medication is for. And then personal safety, trouble managing money. So again, they're not paying their bills. They're starting to get bounce checks, calls from collectors, late payments, or they're spending their money very carelessly and buying things that they don't necessarily need, or it's out of the ordinary for that person to buy, usually something like a large purchase. And then personal safety. Can they identify issues such as what's a fire alarm or a CO2 alarm? Do they have judgment to identify if they should open the door for somebody, such as a solicitor, and let them in their home? Do they remember their garage code or where they have a hidden key? And I think the biggest indicator that someone probably is not safe to stay in their own home anymore is, in an emergency, would they be able to call 911 and safely exit the home on their own? So different types of services that are available in the home for somebody who does want to stay at home. And we're going to go into each of these in more detail. So in-home care, home health, home delivered meals, personal emergency response systems, transportation, and geriatric care manager. So in-home care is a service provided by a caregiver in the home. This can be through an agency or an independent person. I like to go into a lot of detail about in-home care because it can be one of the more tricky services to hire, and maybe you don't have a lot of trust around it. And there are a lot of things to know when you're letting somebody come into your home and help care for your loved one. So in California, these agencies must be licensed as a home care agency. And in a lot of other states, they do need to be licensed as well. They can help with household tasks, meal preparation, transportation, and running errands. And then they can also help with more personal tasks such as bathing, dressing, medication reminders, or they can simply be there for companionship for someone if they aren't getting a lot of social interaction. They are usually paid for privately, but they can be paid for either by Medicaid, the VA, or long-term care insurance. They're almost always charged by the hour. Caregivers are not usually CNAs or other skilled type of workers, so they cannot administer medications, do wound care, or any other monitoring of health status or diagnosis. And some questions to ask before you're hiring a home care agency. So ask questions based off of your loved one's need. So maybe your loved one doesn't need help going to the bathroom. You are just hiring them to help run errands, pick up prescriptions, and do some companionship. So ask about those types of needs rather than, can you help with toileting if your loved one doesn't need that. But it is still a good idea to ask about what can be in the future. So if you do think in the future your loved one might need help with toileting, it is great to ask that type of question. Like I said, in California and many other states, these agencies do need to be licensed. Know how billing is done if there are extra fees. So some might charge if there are personal care tasks that need to be done, toileting, bathing, dressing, or if someone is an overnight caregiver, those are also a time when there might be some extra fees, or is it strictly just by the hour? Ask how they hire their workers, if they are licensed and bonded, where do they find the caregivers, what kind of training do they have. If you are hiring someone privately, I would suggest seeing if they have a CNA background and asking for that license and paperwork proof. If you are going through an agency, ask how quickly they can find a replacement if the caregiver is sick. And if you are hiring a living caregiver, please be aware of insurance laws and just workers' laws if you are hiring someone privately, and always have a backup plan in case that person is sick for the day or can no longer work for you. Home health. So home care is the non-skilled caregivers. Home health is a medical care service. So this is usually provided by some kind of nurse, physical therapist, occupational speech therapist. Usually it follows some kind of hospital, rehab, or skilled nursing stay, and usually needs to be ordered by a doctor. This does include different types of therapies, administration and management of medications, monitoring mental and medical diagnosis, pain management and wound care. And then this is usually covered by some type of insurance, whether that's Medicare, Medicaid, or Medi-Cal, and other health insurance plans. And that's why it needs to be usually ordered by a doctor. Home delivered meals, this is usually a great first step for somebody who wants to stay in their home because they aren't able to cook anymore, or they're not able to go grocery shopping anymore. Home delivered meals usually provide some sort of healthy eating, focusing on areas of nutrition that seniors do need the most. Now with technology, we are seeing a lot of people using the meal prep companies or just the delivered groceries from the grocery stores if somebody is still able to cook or wants that to supplement some kind of home delivered meals. Typically the home delivered meals that I'm talking about for seniors, like the Meals on Wheels, the Mom's Meals, can be paid for either by the meal, weekly or monthly, and require little to no preparation. Usually you just need to heat them up in the microwave, or they can be eaten cold. So usually you can do these from just a few meals a week to 3 meals a day, 7 days a week, depending on what someone needs. And then some can be delivered fresh or frozen. And with anything that you are trying out, ask for some kind of trial, whether that is a free or a low-cost trial, just to make sure you are liking the food that you are eating before you're committing to paying a lot of money sometimes for these services. And then also be sure to factor in any kind of dietary needs. So if someone is gluten-free or they need low sodium, high potassium. Personal emergency response systems, I'm such a huge believer in these personally because I've seen them really work. And not only are they, again, just a great first step for somebody who wants to stay in their own home, but it can also give a lot of peace of mind to you as the caregiver, knowing that your loved one has something that they wear in case of an emergency. So these are buttons, personal help buttons that can be pushed in case of an emergency. And not all of them necessarily have to call 911 first. Some may call just a emergency contact, such as a family, a friend, a neighbor, or they can be called in conjunction with each other. They can be billed for monthly, and they're usually private pay, but some can be paid for by Medicaid or Medi-Cal. And then these, again, are just really evolving with technology. They can sometimes detect falls. They can have GPS if someone is still driving or still goes for a lot of walks. Another thing to consider with personal emergency response buttons is I am really talking about the traditional, the buttons, help, I've fallen and I can't get up. But things like the Apple Watch, the new Apple Watch now has a emergency call function available, or it also has a fall detection, a heart rate detection monitor on there. So if somebody doesn't want to wear it because of the look of it, the aesthetic of it, maybe you can look into something more like an Apple Watch, although it is a little bit more pricey. These are great for somebody who is a fall risk at home for any part of the day by themselves. And things to consider with them, are they waterproof? This, I would say, is the #1 thing you want to make sure it is waterproof, because 60% of falls do happen in the bathroom. Does it need to be charged? Again, if it needs to be charged, then the chances are you're going to charge it overnight, and a lot of falls happen overnight because somebody doesn't want to turn the light on when they're going to the bathroom in the middle of the night, and that's when a fall can happen. Their reliability and responsiveness, so is the call center open 24 hours a day, 7 days a week, 365 days a year? What kind of contracts do you have to sign with them? I would suggest one that is just month to month, because you never know when somebody doesn't need one anymore, they're going to move, et cetera, et cetera. Can the unit detect a power outage? Does it need to have power to work? What kind of service does it work on? Does it work on cell service? And if so, does that cell service work in your loved one's basement or in the back room of their house? Or does it work on a landline phone, which most seniors do still have? You shouldn't have to pay for the button and the transmitter separately. Can the unit travel with somebody if they spend part of the year maybe in the Midwest and then another part of the year in the South? And how far away does the button work from the transmitter are all great questions to ask when you are looking into buying one of these units. Transportation, so there are many options available for transportation, and again, with the advances in technology, don't forget to think of things like Lyft, Uber, GoGo Grandparent, which can use Lyft and Uber just over a phone call. Check with someone's insurance or hospital group. Sometimes they offer free transportation to appointments, and transportation can be so helpful for you, the working caregiver, so that you can stay at work. You don't have to leave to go to an appointment, and then maybe you can just conference call in on that appointment. Volunteer organizations such as Elder Help provide rides. There are many of them here in San Diego, so if your loved one isn't in the range of Elder Help's transportation service area, we're happy to offer other volunteer organizations that do transportation in the area. Sometimes support groups offer rides to the support groups. And some things just to look for with transportation is, does your loved one have a walker or a wheelchair that needs to be accommodated for? And then what kind of notice do they need? It's pretty typical to require 24 to a week advance notice for rides. And if you need something sooner than that, that's probably where Lyft and Uber would come in as a more better option. And then if your loved one's able to, look into public transportation as well. Geriatric case managers are professionals who are trained to manage or help manage a senior's care. These are usually paid for privately and can be pretty costly, but can occasionally be offered through a local area agency on aging, so that would be free to you. These are great for somebody who needs help arranging needs from a distance, to be an advocate, or even just an extra set of local hands to manage your senior's healthcare needs. A lot of them will help with attending doctor's appointments and communicating with professionals. They're also super helpful in finding local services. And if you are interested in hiring a geriatric case manager, you can find one through the local area agency on aging or the National Association of Professional Geriatric Case Managers. Again, just a really great extra set of hands, either if you are too busy to help manage someone's care or you are caring from a distance. PACE programs are programs of all-inclusive care for the elderly. That's what PACE stands for. This is a care team, an interdisciplinary care team of health professionals that manage the patient's health from wherever the patient calls home. So in order to be eligible for PACE programs, you must be eligible for nursing home care. So usually you have a pretty high level of care needs. And usually it's only paid for by Medicare or Medicaid. But some services that are available under most PACE programs include your primary care physician, adult daycare, physical, occupational, and speech therapy, a social worker, a home health aide, personal cares, prescriptions, medical specialties, respite care, nursing home, and hospital stays. So it's really all inclusive, and it all is in the same network, so they find all of these specialties essentially for you. Senior centers and adult daycare centers, these are really great for the working caregiver as well. Both of these offer a wide variety of programs that vary by center. So if your loved one is into a certain activity, it's great to kind of shop around and see where you can find that. But almost all of them have some type of meal, health and fitness programs, games, education, and art. Adult day typically has a fee, and that's different for each center. And typically adult day is geared a little bit more towards the patient with dementia. Senior centers are usually free through either the city or the county. But adult day does cover more supervision and a higher level of care because they usually are geared more towards someone with dementia. They usually have nurses and professionals on staff, different therapies. With both of them, you can always look into transportation to and from. Both usually offer some sort of transportation. And another thing to look into for both adult day and senior centers is security of the building, the outdoor spaces. Are guests required to sign in and out? And usually adult day center will offer you a day trial. Shared housing. So through ElderHelp, we do have a shared housing program. Again, great for somebody who wants to stay in their own home, but just needs a little bit of extra help. So this matches a person who has a spare room in their home with a person who is seeking affordable housing. So here locally, like I said, ElderHelp does manage this. So there's a provider and a seeker. A provider is the one who has the extra shared room in their home, and then the seeker is who is looking to move into the home. Here at ElderHelp, we do either rental exchange, service exchange, or a combination of both. So someone needs like a few rides a month, or some extra help cleaning the house, or just a companion. Those are really great examples of service exchanges that we will do here at ElderHelp. And it helps with paying for the expenses of owning your own home as well. And then placement agencies. Again, this is great for the working or the long distance caregiver because they help in choosing a living facility. Different names for placement agencies include assisted living referral services, assisted living locators, placement management services. Also really great if your loved one is moving to a different town and they are looking for a living facility but don't really know where to start. These people are experts in a local area of all the living facilities. They should be free of charge. They kind of get that referral bonus that from the facilities for referring someone to live there. And so this also makes them usually pretty unbiased because they're going to get that bonus from no matter where they refer on to. Just something to ask them is how they find their facilities and if there are certain corporations that they work with or that they don't work with, so that you can see if they have any biases. So one of the hardest things when talking to your loved one about moving or staying in their own home safely is starting that kind of conversation. So here are some tips for how to start that conversation. You want to start it early. It's best done when the senior is safely living in their own home independently. And a decision doesn't have to be made right away. There's no pressure to make the decision or maybe a bias that's going to make someone lean a certain way. Use positive language and empathy. So talk about the benefits of either moving or staying at home rather than the negatives of moving. So it could be costly or one-on-one attention. Talk about different options. So ask things about, would you rather move or would you rather have somebody come into your home and take care of you, such as a home care agency? Bring up things about, well, what if dad were to get sick? Mom, what would you do? Finances, of course, as well. If somebody is diagnosed with a disease that you know there's going to be a progression, that they're not going to be able to stay at home safely, know the progression of that diagnosis so that they can stay involved in their care. You know, saying things like, we probably have a couple more months for you to make this kind of decision, so I want to make sure that we're being on top of that right now. Focus on independence. Saying things like, you know, I'm really worried that if you do have a fall, then you break your hip. you would have to go into a skilled nursing facility. And I'd rather see you make these changes now so that you can stay independent and that wouldn't happen to you. Make it more about you, the caregiver. So it really worries me that you're not making these decisions, and I want to know for my own peace of mind. And then, of course, empathize and listen, validate their feelings and listen to their concerns. A lot of this conversation is probably a little bit more about listening than doing the talking. So a couple other in-home help options that aren't necessarily services are home modifications. This can really help with eliminating falls or loss of independence. So just increasing the lighting in a home. A lot of people don't even think about these things. Adding additional railings on the stairs, adding grab bars in the bathroom. Grab bars can be so discreet now, they just look like towel racks. Something like a handheld shower head, a seat in the shower, a walk-in tub. And then, of course, removing the throw rugs and the clutter. So important for falls. You can even do things like rearranging cabinets and shelves so that often reach for items are more accessible and don't require something like a stool where someone can fall off of that. And then again with the lighting, and just installing things like night lights, motion censored lights, smart lights, where someone can use like their Alexa to turn the lights off once they're in bed or before they get out of bed in the morning, or if they use a smartphone to turn them on and off from there. And then some technology that can be super helpful and affordable for helping someone stay in the home. Again, the personal emergency response buttons, or a smartwatch, such as the Apple Watch that has the fall detection. I've also heard people using Apple Watches for the working caregiver in a meeting. You can just simply draw a question mark to your loved one, and they can just reply with a smiley face to do a little check-in during the day. Home delivery services, we're so lucky with things like Amazon Prime and food delivery and grocery delivery and all of those types of things where we can't get out of our home. It's so easy to get literally everything delivered, or you as the caregiver, if you don't even live nearby, or even if you do live nearby, you just don't have the time to spend an hour stopping by someone's home to just deliver things and have next day delivery for someone. Smart speakers such as the Alexa have been there's so much research going on with the smart speakers and seniors in alleviating loneliness and helping with things such as, like I said, turning on the lights, home security, the thermostat. The list goes on and on with every day the technology that's coming out around smart speakers, and they're so affordable for what they can do for a senior, reminding them medications, appointments, ordering Uber and Lyft, ordering groceries, ordering things on Amazon, and then they don't even have to have their own account or learn how to use an iPad or a smartphone. And then, of course, the smart home technology. Home security is one that is really, really important for seniors, where they can see on their camera who's at their door before going to the door and talk to that person so that they are staying safe from those scams or someone trying to get into their home. And this is just really scratching the surface when it comes to technology and seniors. We have a whole webinar on it available on our YouTube channel, but I do want to mention it because it can be so helpful in helping someone stay in their home and just so accessible in learning how to use now. So some upcoming events that I just want to talk about this Saturday. I will be at the Navigating Caregiving for Veterans and Military Families at the First United Methodist Church in Mission Valley. That's from 9:30 to 2. And Planning Ahead, Learning How to Ensure Your Decisions Will Be Honored is on October 24th from 9 to 2 at Balboa Park Club. Both of these you can register through sharp.com/classes. And the Planning Ahead, Learning How to Ensure Your Decisions Will Be Honored is about navigating end-of-life options, making better informed decisions. Participants will be able to identify goals and understand the importance of making decisions now. And Elder Help Again will be at that event, both of these events. Next month, our webinar will be on Alzheimer's and dementia. That's on November 15th at 11 a.m. If anyone wants to register for that, you can, of course, email me or let me know right now. I'm happy to send you out that link. And I will stick around for a few more minutes if anyone has any questions. If not, here is my information. Here's Elder Help's information. If you have a question that you do not feel comfortable asking, and right now you want to ask that in private, please feel free to email me or give us a call. Otherwise, I hope everyone has a great rest of their day, and thank you so much for tuning in.